South Carolina, a hotspot for measles as cases continue to climb and the virus continues spreading. The Department of Public Health reporting this week of public exposure outside of the upstate outbreak zone. News 2's Emma Charles joins us live in the studio. And Emma, you've been tracking the outbreak since it was first reported. You had a chance to speak with some experts today. Give us an idea of what they are telling you about the status of the increasing number of cases.
Well, Carolyn, not good news, but so far all confirmed cases are in the upstate. Today, doctors told me with this increase in cases there and a confirmed exposure in Columbia, it's highly likely that measles could spread to other areas of the state.
Measles cases have continued to rise in the upstate. The Department of Public Health reporting 124 new cases since Friday, bringing the total number of cases in the upstate outbreak to 434. But experts warn people in other parts of the state should be vigilant. A public exposure confirmed at the State Museum in Columbia on January 2nd. Anyone who was there between 1 p.m. and 5 p.m. may have been exposed.
The increasing number of settings where we have identified public exposures that may be outside of the Spartanburg area is a concern that we may see cases in other areas.
The South Carolina Department of Public Health is testing selected wastewater treatment facilities throughout the state to detect measles early and monitor its spread across the region.
So the information that it gives us, unless there is a sustained positive signal, is somewhat limited, but it is an early and additional very beneficial surveillance system that can give us a picture of where measles may be being circulated that has previously been undetected if people have not yet sought medical care.
The department says 98% of the cases are in unvaccinated people. So epidemiologists say it's important to get vaccinated. Measles can cause legal blindness, brain swelling, and even death.
Because of a percentage of young children who will get severe manifestations of measles, blindness, brain damage, who ultimately could land in a nursing home for the rest of their lives, economically it makes sense to get the vaccine so you can prevent that from occurring.
So with the measles spread becoming more of a possibility in our area, doctors say now is the time for you or your children to get the measles vaccine if you do not already have it.
There is no doubt that decades of research have proven how effective these vaccines are. Well, obviously all vaccines have side effects, and we never mean to diminish the risk. The reality is the benefit far outweighs those risks.
And doctors say if you were born before 1957, you're considered immune and do not need the vaccine. It's important to remember 2 vaccine shots were not mandated until the late 1980s, so doctors recommend if you were born before 1989 to check with your doctor about a booster shot. But a booster may not be for all patients, especially the elderly and immunocompromised. In studio, I'm Emma Charles. Count on 2.